In Germany, they just started a new major research scheme. It's lasts a couple of years, 3-4 years, and there are 3 research groups involved in. I'm trying to find the pointer. Is it here? Yes. You see, in Hamburg, Hanover, and Köln, Cologne, 3 research groups come together to do what they call mixed method approach. So they use questionnaires to have some numbers and to calculate in their computers, but they also ask people about their experience and their opinions, and they also, what I find pretty interesting, they analyze literature and documents of groups, of organizations, of clearinghouses, etc. And these are some of the first results. In Germany, we have approximately 300 self-help clearinghouses, and they contacted 284. I do not know why they did not contact all of them, and unfortunately only half of them participated. I was very angry about this, because I had tried to promote the whole thing and to encourage my colleagues to participate, because it's very wise to support researchers, because they give something back to us, arguments, opinions, etc. Right. The average age, not of the workers in the clearinghouses, but of the clearinghouses, is 17 years. That's quite interesting, because it tells us that very few are added in the last years. So over a long time we have a stable situation, not a decreasing number like in the US, but a very stable situation, and some are already active over 30 years. So it's a very well-established traditional business in Germany, part of our social welfare system. Usually there are only 2 workers sharing 1 full-time equivalent. So they are not big bodies, they are not big institutions. It's usually only 1 or 2 persons. And that means that the style this colleague does it is absolutely predominant and for what other people experience, cooperative partners, etc. On average, 180 groups are known, registered, collaborating, whatever you want to name it. The goals that these colleagues are following are the classics. You know, they give information to people, they support founders of new groups, they support groups working already. That is traditional, we do it over decades now. New development, that is what the colleagues told the researchers, is it's much more on networking, which means, if you remember Ed's presentation, a lot of this is already done by themselves or by the support of their national organizations, etc. But to network between the groups and especially to foster cooperation with experts. That tells you that more and more self-help represented through clearinghouses is part of the game in a community, in a municipality, etc. Self-help friendly climate, that is a new topic in Germany, which means our aim is no longer to support individuals or groups, but the society in total. We are not narcissistic, no, we only want to influence society in total, which is in reality, we try to influence certain institutions like hospitals, private practice of doctors, administrational departments, etc. So self-help friendly hospital, that is one famous program in Germany where people in another research project collected 8 criteria what makes a hospital a self-help friendly hospital. I don't go into details here. And another thing which is more and more dominant in the work of self-help clearinghouse workers is to promote and to help to implement patient orientation. That is a political term. The whole system, the whole health system in Germany is more and more going in this direction. That is a question of democracy. and it is a question of competence. So some brains on top of our society are of the opinion that people, ordinary people from self-help groups, can contribute something. They are not only consumers. They want more and more service, more and more drugs, and they live longer and longer, and that's very expensive. No, they have to contribute something. The services for self-help groups offered in the clearinghouses is the classics: get funding, find an adequate room, organizational support. Further education and seminars for group leaders is more and more practiced, not for whole groups, but for group leaders. Seminars where people from various groups come together and are trained in certain aspects which they share. My colleagues speak of supervision and counseling for groups, not for individuals, that's what the groups do, but for groups as such. And they speak of crisis intervention. That sounds so dramatic. Being a clearinghouse worker over more than 30 years, very rarely I encountered a crisis. Well, they have problems in communication. Sometimes they have a person they want to get rid of. Sometimes they have problems in communicating with cooperation partners, with doctors or whatever. But real crisis, we reserve that term for certain countries, but not for self-help groups. Conflict mediation, I found that a nice term. That's softer, you know, okay? Like in a couple, I mean, they are not killing each other, but they have problems. And in the presence of a third person, it's always easier, right? Whenever a guest comes to your house, you behave properly, right? So if a third person comes, you have to explain what is the problem. I never thought of really what is the problem, etc. Services for professionals, that's interesting, that more and more professionals request speeches on self-help groups. What is it exactly? What can we expect? If I refer a patient, is it correct or incorrect? Another, a special part of it is, maybe that's not good English, guarantee for seriosity. That means the doctor calls me and says, Mr. Matzat, do you know this and that cancer group? Is it a good group? Right? Is it stable? Is the contact person reliable? Do they have really experience, etc.? So they want to have somebody who plays the role of a certificate. You know, doctors have certificates, psychotherapists have certificates, and we usually believe in certificates. They have nothing. So, for example, if they want to have funding from health insurance, the health insurance asks them for a certificate, a written certificate, for example, from me, that this group exists. Because everybody can write a letter, I want to have some money. Okay, this is also interesting. More and more institutions in Germany are proud to say we do cooperate with self-help groups. That refers to the self-help friendly hospital. So more and more, like we are smoke-free, we are children-friendly, we are handicapped-friendly, etc., etc. It becomes a marker. Growing time consumption, that's what my colleagues say in the clearinghouses. The administration, self-administration, it's more and more complex, more and more forms we have to fill out, more and more regulations. In earlier days it was like that, you know, okay, you're a nice guy, so you have some money. And this is a new word that you all should learn. You understand the word? You never heard the word, but you do understand the word. Okay. That means that more and more funders say we don't fund you as an institution. We give you money for a folder, for a leaflet, for a poster, for a seminar, etc., etc. And that creates a lot of work to do all these applications, etc. And it does not fund the personnel, the staff. So those who do the project, they are underfinanced. To find money for projects, that's not a problem. New trends, my colleagues were asked what are the new trends, and the mega trend is mental disorder. That is the predominant topic for people calling self-help clearinghouses. That has to do with the growing prevalence of, for example, depression. Now, to be fair, we have to say that it is not really a growing prevalence. It is a growing, what they call administrative prevalence, which means people are labeled and documented as being depressive. For example, we have a curve like this, depression, and a curve like this, back pain. Yeah, some people understand immediately. So in earlier days you had back pain, and now you have burnout and things like that. So the way doctors label them, that is changing. But nevertheless, it has the consequence that more and more people are asking for self-help group in these areas. The question of destigmatization, that's also a discussion in Germany. Maybe one or two football experts remember Robert Enke, who was goalkeeper of our national team in football. I forgot to mention that it's the football team because everybody knows that we are reigning world champions. So, yeah, so Robert Enke was goalkeeper of the German national team, and he committed suicide. So a very rich, a very healthy, a very successful young man committed suicide. And that was a big question mark for the German society. How can this happen? So that helped very much to destigmatize, you understand, the whole topic. But on the other hand, we have a return. Just recently, a German aircraft pilot committed suicide, including 150 patients, by bringing his aircraft into the French Alps. And that means, are depressed people dangerous? It even leads to a discussion if psychotherapists and doctors should give the information to the authorities if somebody has such a profession, etc., etc. So it's a very mixed discussion in Germany. And what's also interesting, waiting list problem. In Germany we have by far the best service system for psychotherapy. By far. The number of psychotherapists is huge. I think it's about 50,000 or 20,000 in Germany. Free access for everybody. Health insurances cover it for everything. You don't have to pay. So the number of Germans in psychotherapy is huge compared to other countries. But nevertheless, there is a waiting list. Obviously, supply and demand are in a strange relationship. Obviously, the more supply we offer, the more demand is there. You know, it's not like washing machines. If everybody has one, then it's the end of the market. So, therefore, because of the waiting list, and because we have such a good system, more and more people come, for example, after they have been treated in special hospitals. We have special rehabilitation hospitals. And then they say, for the first time I had the experience of group psychotherapy in this special hospital. I didn't want that, but they forced me. I had to go to these bloody groups. And I tell you what, in the end, that was most helpful, right? So now I want to have a follow-up self-help. That leads to my questions. That's not part of the research project. What does that mean to our activities? Do we have to act in a different way towards depression self-help groups compared to addiction or a cancer self-help group? But that's a wide field. Interesting is the clearinghouse workers were asked about their self-experienced work conditions and their satisfaction. Very high work satisfaction. All of them said, that is a great job, it's fantastic to do this. Why? Because we have a high degree of freedom to organize our job. And that is a well-known factor from industry of vocational psychology. The more you have freedom in everyday decisions, not the general idea, but everyday decisions. And if you have the resources to do that, then you are most satisfied. They feel also well integrated in the network of services in the localities. They have enough opportunities for further education. That was also an interesting point, that we offer a kind of seminars, annual conventions, etc. in Germany, so that was also highly estimated. But the negative thing is they all said, we are terribly understaffed, we do frequent unpaid overtime, they work more than they are paid for, and it's a bit unclear if that is external pressure or internal over-motivation. Maybe it's a combination of both. They are all what we call good people, you know. They all have these high motivations and solidarity and the poor people, and you know that because you're all of that kind. Challenges for the groups, big discussion in Germany that many groups are at the end of the first generation. Often the founders are the group leaders over decades. And then at some point they are exhausted, they are burnt out or simply die. And then it's very often difficult to find new people. I call it succession plan. I don't know if that is good English. So groups have to learn to make fantasies. How will it go on if she will one day quit this position? I jump to the last one, overstretching of self-help clearinghouses. They are invited to do too many things. Is that an expression in your language as well, to dance on 2 weddings? It's more than 2. And that is the end, and that's the village where I live.
Thank you, very clear presentation. I have heard you rather many times, and you have last 2 conferences also you told about that there are not so many participants and founders are old, and so I'm wondering this problem orientation, this self-help, that you must have certain problem and narrow. Because I work, you remember what I have said, that women don't say they are alcoholics or anything. They must have their area. So you have now asked the workers, have you, the staff, have you not asked the participators what they want and what would like this young people, they don't want to be labeled very young, in their abstract categories and so on. Have you ever thought like that, and this social work, social forces should be included in today's psychology also?
Well, as I said, this is a report from work in progress, so the whole project is running on for a couple of more years, and they deal with all 3 elements of self-help as we understand it in Germany, which is self-help groups, small, local, self-help organizations, much more formalized on national level, and self-help clearinghouses. And I only presented first results from this one piece of the cake, which is dealing with clearinghouses. So this question is dealt with on other pages of the book.
Yes, but you need answer to that this problem. How do you define them and why people don't come?
You talk about the problem-centeredness.
Yes.
Yeah,
yes.
Okay. Well, my point of view is self-help groups are always centered around a problem, otherwise it would not happen. People must have a motivation. They are suffering from something. And the numbers in Germany show that approximately 85 to 90% of all self-help groups which are in contact with the self-help clearinghouses belong to the health sector. So it's predominantly health-oriented in Germany. So there's nothing about homelessness or things like that. There are some women groups, but very few. That is sort of a past decade. That was in the 70s, 80s. It doesn't exist any longer.
Just a short remark. Maybe this got something to do with the financing of self-help groups in Germany, because as far as I know, the German self-help groups are financed by the healthcare system.
Yes, that quite a good remark. That is not the reason, but it, how do you say, it increased the effect, because what he's referring to is that health-related self-help groups in Germany have the opportunity to get money from health insurances. Of course, they would not pay to a women's group. Only if the women's groups say we are suffering from depression or breast cancer or something, then it becomes relevant for health insurances. And that is a privilege. Other groups could also be founded, other groups would also be supported by clearinghouses, no question. The clearinghouse approach is we cover all topics, it's only a question if it is a self-help group, whatever that is. Right? But I repeat, your remark is quite correct that this was promoting and triggering the effect for the health part of the panorama.
Just to come back to the supervision and counselling that you mentioned, Jurgen, is that's provided by clearinghouses for the groups? I just wondered if you could just broaden that a bit more. What does that mean? Does that mean some counselling, supervision for the founder of the group, the key member, or the groups as a whole? If you could just broaden that description.
Yes. I think what my colleagues mainly had in their mind was that groups as groups can approach the clearinghouse and can say, well, we have a problem, could you help us? And then the clearinghouse worker would go there and would discuss the problem with them. So that's, for example, what I do in practice. Theoretically, I would like to make an appointment at a day or a time which is not the routine meeting of the group, to make clear, now we are not in a group meeting which is guided by a professional, and I'm such a smart guy and you better listen to me, but my approach is like, I always say, like parents whose child is suffering from whatever. The responsibility remains with the parents, and the psychologist would only discuss what did you try until now, why do you think it did not work. That kind of process I join with these groups. So I think that is the main thing of supervision. I had these things around the supervision, which means it's not a continuing process. In my place, we offer, but that is an exception, we offer a continuing supervision type of approach for groups with psychological topics only.
Yeah, it was just a question because in England, counselling would come across different to us, more professionally led. I wouldn't use that term in England in my role, although it means the same, that if a group came to me with that, we're at crisis point, that we're low on funds, we've got low members, we think the group may close, that would be a support role for me. Where in England, the reason I asked the question was counselling is very much that professional one-to-one, if it's a psychologist, that kind of thing. Does that make sense? It's just a different term. In different countries we're using a different term for counselling.
Here we have the language problem.
No, that's fine. That's why I was really interested to think if counselling was actually going into the group. It was quite interesting.
Yes, I think the Germans are a little bit closer to this counseling thing. We would say what you do it, or what you just described, that's more organizational things and things like that. But they all come from the field of social work or even psychology, so they feel they can do it, don't ask me, and if they love to do it, don't ask me. So this, let's say, more personal encounter and thinking in a counseling way about things. But to make a clear difference, we are not discussing the problem you have. We are discussing the way you are running the group.
Yeah.
Okay.
Yeah. Thank you. Thank you.
We have time for one more question.
There is found a lot of differences in the way of work. Okay. I haven't. Everyone here. There is found a lot of differences between how the clearinghouses are acting. There is variant, or they're doing more or less the same, or did they check it?
Yeah. I think it's more the same than different, because they are all so old, and because we have a well-established association and we produce leaflets on how to do or what we recommend. We have this annual convention and smaller seminars where the colleagues come for further education, and that leads to a certain adjustment of my style and your style. The more often we communicate, the more likely I adopt some things from you and some things you adopt from me. So this is, I think, a process of becoming narrower to each other.
And cultural differences, ethnic differences, they're not...
I mean, Bavarians are totally different than other Germans.
I don't know, I don't know, immigrants and...
Yeah, okay. The immigrant topic is that although many of my colleagues tried so hard, there are no immigrants in self-help groups, to sketch it very roughly.
Wow.
Yeah, that has to do with language problems. If you don't speak German, sorry. And secondly, it has to do with mental problems that you have to adopt to a certain...
not have a group of, I don't know, immigrants from Turkey that have cancer?
Yes.
That speaks Turkish, I don't know, yeah?
No, it's very, very rare. It's very, very rare. They try so hard to do it with diabetics because the rate of diabetes among Turks is much higher than among Germans. So for the health system, it's really a problem. But they are not successful. It's not possible, roughly speaking, it's not possible to bring them together and to adopt our idea of self-help group, which is not led or guided or whatever by a professional. Because they have a completely different view of what an illness is, what a doctor should do. Of course, there are we call it self-organizations, not self-help organizations, self-organizations of migrants of all kinds, but they are oriented around language, around culture, they do dances, around religion, of course. You know? So that has very few connection to our activities. People tried, but